And repeated exposure to x-rays and CT scans can increase a man's risk of testicular cancer later in life. A study found that men who had diagnostic radiation below the waist at least 3 times were 59% more likely to develop a testicular tumor. How long it takes for a woman to get pregnant may depend on the type of contraception used and when that usage stopped. Researchers say women who used IUDs had to wait the longest, up to 8 months, for their fertility chances to return to normal. Researchers say less screen time and more sleep are key to preventing depression. A study found that eating high-quality foods and getting exercise also contribute to a positive mood. When it comes to the coronavirus, some activities are safer than others. Dr. Maria Simbra looks at the places where your risk of being infected goes way up.
Restaurants, gyms, and coffee shops are the riskiest places for catching coronavirus.
So you have a lot of people in a small area where you are not able to wear face masks. Obviously, when you're eating and drinking, you can't wear face masks. And where ventilation may be less is going to be a high-risk location.
In a study published in Nature, researchers used cell phone data to analyze the movement of people from March to May. They looked at where people went, how long they stayed, how many others were there, and where they came from.
It's really important to understand what are the activities that are safe and what are the activities that are higher risk. Who are the people who got the disease and who are the people that did not, and look at their activities and try and see where the associations are.
The information, along with case numbers and viral spread patterns, went into a computer model. The results showed if these venues opened to capacity, they would be the source of 3 times as many new infections than other kinds of places.
So it's not perfect, but it's very useful data because it looks at a lot of people and it fits with what we understand about the virus.
Also, 10% of the locations would account for 85% of predicted infections.
We're hearing a lot about what are called super spreader events. When you have a group of people together in a closed, confined space, you could have a rapid increase in the number of cases.
Most of our day-to-day activities are not dangerous, but Dr. Venkat points out cases and hospitalizations are going up. He worries that unless people do their part and wear a mask around other people to curb the spread, the hospitals could get overwhelmed. I'm Dr. Maria Simbra, KDKA News.